On behalf of myself and my team, and just thanking the Willow Health team once again, I welcome you all to this roundtable, and thank you very much.
Thank you so much for making the time to be here physically. I know after COVID, we have been used to doing everything online, 1 hour, 2 hours, we are done. But we thought if we are here physically, you know, there are things that you can learn when you network, when you get to know people. There are certain other things that you'll pick from this conversation that you may not pick online. And it's good to network, and especially from the team that has come in all the way from Nigeria, we appreciate and we look forward to a very fruitful and engaging conversation.
How we finance our health system increasingly comes back to, are we raising the right kind of money? Is that money available for the right kind of health system we need to build to tackle the challenges that are in our populations? I think it is the smart thing for Africa to do in the immediate term, so that if money ever comes back, it feels it's additional versus core. And I think for too long we thought of that as money that fundamentally drives our core infrastructure, our core healthcare infrastructure.
We need consistent leadership. We need strong collaboration. So kudos to Willow Health Media, to Nigeria Health Watch, to Axum, to be able to bring stakeholders like this in a room to discuss these issues. It is the first step in that collaboration. And then the progress requires, I would say, greater alignment between the health and finance ministries. So a lot of the work we do is directly related to the finance ministry, even though we are advocating for health. They cannot be left out in these conversations, even though it is a health conversation. So that would lead to better enforcement, stronger public trust, and I know a few of you here are in media, so how do we get this publicized and the impacts of this to be able to get the public on board? And then finally, using evidence to make sure that message is clear.
We are not sure that we are going to achieve the public health objective, because when we increase the tax so much on beer, then the people will start taking local brew, changa and others. When we increase the tax so much on cigarette, then they'll start smoking something we call kiraiko. You know, they just make it at home and they smoke. And when you look at these alternatives, then they pose even a bigger danger than what they are stopping to smoke. Nonetheless, then I would say this, that even if we are looking at a reduction in consumption, then we need to really, our entry point into the sin taxes, and this is where we usually miss the point, our entry point should be the public health objective.
The data that for me that really stands out is really the burden of disease as far as non-communicable diseases is concerned. So we look at what is the prevalence of these non-communicable diseases in the society. We look at really what is the cost of these non-communicable diseases on the individual, on the household, on the community, and on the society. And when you have this data, it will help you now to move forward to the level of, okay, now what is the impact, what is the outcome of this on morbidity and on mortality?
It's very easy to say, let's tax tobacco companies on their production, beverage companies, including sugar-sweetened beverages. But I'll say to you easily, in a place like Nigeria, you easily find people buy, added sugar off the shelf, and they don't pay tax on those.
In my community, they say if you host a party and people don't come, it's not a party. So we've hosted a discussion. If you hadn't come, then it should have been probably Vivian and I exchanging, our ideas, and then saying we've had a conversation, but you have made it to what it is, and we are really glad that you had the time. And I know the next time we call you, you will all come and we'll continue this conversation.